360. Okay. All right. So first, I'm going to introduce myself to my patient. I'm going to wash my hands. My name is Erin. I'll be your student nurse for the day. Can you tell me your name and date of birth?
Alyssa Smithson, 10/9/97.
Okay. And see if that's right. Okay, that's right. So I'm going to be performing a full body assessment on you, if that's okay. Okay. My patient's mood is pleasant. Her appearance, she's well groomed. Her speech is clear. And that's it. I swear. Oh. Her body build. She's small in stature. Okay. So I'm gonna ask you, do you know where you are right now?
Mm-hmm.
And can you say
1723 Payne Street.
Thank you. And you already told me your name. And what are you here for?
A full body assessment.
Okay.
Exam.
Okay. And do you know what day of the week is?
Friday.
Okay, so she's celebrating oriented times 4. Okay, so I'm gonna ask you a few questions about your skin, okay? Do you have any skin issues like allergies or rashes? Have you had any changes in moles? Okay. Do you have any bruising or hair loss? No? Okay. So now I'm gonna inspect your skin. So I'm gonna feel her skin. Okay, it's warm to the touch, and her skin is dry and intact, and her skin color is appropriate for her race, and her skin is smooth. I don't see any lesions. Okay, so that's it for that. Now I'm gonna move on to your heart, okay? So I'm gonna ask you a few questions about your heart. Do you have any difficulty breathing? Do you urinate frequently at night? Okay. How many pellets do you use?
None.
Okay, that's crazy. And do you have any history of heart disease? Okay, and do you have any family history of heart disease? Okay. All right, so now I'm gonna inspect for jugular vein distension. And so I'm gonna, if I had a bed that went down, I would put her down to 30 degrees, but we're just gonna pretend, and I'm gonna have you turn your head to the left, and then I would be looking for the jugular vein distension, and then I'm gonna have you come forward, and yeah, put your neck back. And then I would see if there was any distension, and I did not see it. Okay, so now I'm gonna palpate your carotid arteries, okay? So if you just come over here, I'm just gonna palpate over here. Okay, and this side. Okay, so those were smooth and moderate strength and equal bilaterally. Also, my apologies, that is my dog. Lion. Okay, the show must go on. Okay, so next I am going to auscultate for bruise on carotids. Also, my stethoscope doesn't have the diaphragm part, so I'm just gonna press, the bell part, so I'm gonna press lightly. Oh, I'm so sorry. Can you take a deep breath in? And you're okay. Didn't hear any turbulent blood flow. Once again, deep breath in. Okay, you're good now. And I did not hear any turbulent blood flow with that. Okay, so So now I'm going to auscultate her chest. So I'm gonna start with her aortic. And then her pulmonic. You lips it up a little bit, thank you. I'm gonna go under here. And I also need to go like right in here. I forgot to go to that part. So we did the aortic, pulmonic, Erb's point, tricuspid, and then mitral. Because I forgot to even verbalize half of those. So 1, 2, 3, 4, 5. Yeah. Okay. And then I don't know if I need to say, but aortic is at the right second intercostal space. Pulmonic is at the left second intercostal space. Erb's point is at the third left intercostal space. Tricuspid is at the left sternal border. And the mitral is at the left fifth intercostal space at the mid-clavicular line. So I don't know if that was needed. But. Okay, so now I'm going to move on to your respiratory assessment. So I'm going to ask you, do you have a cough? Do you have any trouble breathing or shortness of breath? Okay. Do you have a history of respiratory disease or lung disease? Either one of those? And those are two separate questions. Okay. Excuse me, I'm sorry. Okay, so now I'm gonna inspect your chest for symmetry. And her chest is symmetrical. Her shoulders are symmetrical. Her AP ratio is, put your arm up, I'm sorry. I'm looking like right here. It's 2-to-1. And then her respiratory rate is even and regular, and she's breathing effortlessly. And then I think that's it, but if I remember something, we'll come back. And then I'm going to palpate, okay? So let me know if you feel any tenderness or pain, okay? Nothing?
Mm-mm. Nope.
Here?
Nope.
Okay. Okay, so no tenderness or pain. I did not feel any crepitus. And then when I put my hands on you, you're gonna say blue moon, blue moon, blue moon, okay?
Blue moon.
Like, say it more.
Oh, blue moon. Blue moon. Blue moon.
Okay, again.
Blue moon. Blue moon. Blue moon.
Okay, one more time.
Blue moon. Blue moon. Blue moon.
Okay, so I feel those vibrations, so we're all good with that. And then, oh my gosh, I remember I didn't listen to her with the bell for her heart. Should I do it like now?
Just do it. It'll be fine.
Okay. I mean, you guys said we could. They did. Okay, so remember light. It's light. And then can you lift it up? Okay, I didn't hear any turbulent blood flow. I also didn't listen to her apical heart rate. What a bad nurse. I guess I'll do that now. I have to do it for a minute though. So let me mark where I am in my respiratory assessment. What did I do? Tactile affirmative was the last thing I did. Okay. So now we're gonna do the apical heart rate, okay? Okay, I'm gonna put that down. And I'm gonna use your watch as a timer because mine's dead. Okay, so her apical heart rate is 72. Okay, so after my tactile affirmatus, I'm going to percuss. Okay, so it's a little hard to do it through all these clothes, but I mean, we get the idea, right? Okay, and it was resonant sounding. And then I'm going to auscultate. I just put it on. And then just take nice deep breaths, okay? But just when I let you know. And can you sit up for me? Like, don't be doing that. Sorry. I just need to hear you, okay? Okay, go ahead. Okay. Okay. I think they said we had to do 3 to 4 slots, so I'll just finish out with right here. Once again. Okay, so her lobes were clear, equally, and bilaterally. So, now, I'm so sorry about her. Now, we're gonna do the other side, okay? So could you possibly do like crisscross applesauce on that side? Okay. So now I'm going to look at my patient. I'm gonna look at her posture. Well, now she's sitting up straight. So her posture's good. Her shoulders are symmetrical. Her skin color is appropriate for her race. I don't see any lesions or anything on her skin. I think that's it. we can do chest expansion. I think. Okay. So I want you to just take a deep breath in and out. Do it again. And out. Okay. So her chest expanded equally bilaterally. So now I'm going to feel you for any crepitus and then tell me if this is tender, okay? Or if it hurts or anything.
Nope. 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 Nope.
Okay, so she's good there. Now again, you're gonna say blue moon, blue moon.
Okay. Blue moon, blue moon, blue moon. Blue moon, blue moon, blue moon. Blue moon, blue moon, blue moon.
Okay, so the tactile primitus vibration was there. Okay, so now I'm gonna percuss. Okay, so that was resonant. And then now I'm going to auscultate. And I want you to take deep breaths in and out. Okay. So her lobes were equal and clear bilaterally. I gotta check the time. Oh my gosh, I can't go. We gotta go. Cause here, turn back around. They said no more over 25 minutes. I guess I'm just taking my little sweet time. Okay, so we're gonna do, sorry, my head's itching. We're gonna do peripheral vascular. So I'm gonna ask you, have you had any changes in skin color? Do you have any swelling in your legs? You said no? Do you have any like leg cramps or like muscle cramps? Do you have any like new or like old like sores? Okay. All right. So now I'm going to feel for some pulses on you. Okay. So I'm just going to actually, can I take this off? I'm just going to feel for your brachial. I'll just do. So brachial, and then ulnar, radial, sorry, radial and then ulnar, wrong. This is brachial. And then popliteal is behind the knee. Here, you can do those. And then your posterior tibialis is on the ankle right here. So we'll do those. And then posterior pedialis is on the tops of your feet. Okay, so all of those are moderate strength, bilaterally smooth. So now I'm going to measure your radial pulse. Can I use this again? What's this Pascal? Okay. Okay. Her heart rate was 86. Okay, so now I'm going to test for capillary refill in her fingers. Okay, comes back in less than 2 seconds, and in her toes. Comes back in less than 2. I just remembered, I think I forgot to do skin turgor. I think.
Still no.
Skin turgor. Skin returns in less than 2 seconds. It's already at 25.
We'll just finish it out.
Okay.
Okay.
Alright. I just talked too much. Maybe I can do some like speeding in it. Okay, so then I'm gonna look for edema in her shins and feet. So pressing for edema. Okay, there's no edema present. No edema present. No edema present. No edema present. Okay. And then can I have you lay flat right here, head right here? Okay, so have you had any changes in appetite recently? Nausea or vomiting? Any abdominal pain?
No.
Have you had any abdominal surgeries in the past? Okay, so now I'm going to inspect. Can I pull this up? I'm going to inspect her stomach. Her contour is flat. Her skin is appropriate for her race. I don't see any lesions or anything. She make sure. I think that's it. Yeah. Okay, I'm gonna auscultate. So first I'm gonna auscultate for any aortic bruise on with the bell. And there's no turbulent blood flow. And then now I'm gonna move on to each quadrant. Okay, bell sounds present. Bell sound present. Bell sound present. And bell sounds are present. Bell sounds are present in all 4 quadrants. Now I'm going to percuss. So we're going to do inside, outside, inside, outside, inside, outside, inside, and outside. And it was tympani, her tympani, maybe a little bit of dullness. Okay, and then now I'm going to palpate, okay? So I'm going to do light palpation, and I'm palpating for any pain or tenderness. Let me know if you feel any. So I'm just going to do light palpation in all 4 quadrants. Nothing?
Nothing.
Okay, and then now I'm going to do deep palpation. Nothing? Okay. I think. No, there's something else. Here, you can sit up. Oh. Can you turn around again? There's one more thing with your back. I'm going to do CVA tenderness. Okay. So you just let me know. No, I'm feeling for your ribs. Oh, sorry. Her ribs are really down low. Okay, so tell me if this hurts. Okay. And that concludes the exam. Thank you.